This is a bleeding control video and shock management. So my first thing that I want to do is put in my proper PPE, so gloves and possibly eyewear. We arrive on scene when we see a patient that is obviously bleeding. So we're going to just use our leg right here as an example. So my first thing, my scene is safe. I'm going to apply direct pressure with my gloved hands and my sterile bandage to the wound and apply pressure. If based on this, for an extremity wound, if the pressure is not controlled, we're going to place a tourniquet. So I have my tourniquet here, and we would want it just above the injury. And I'm not going to do it tight on him, but so we do that, and then we crank it and secure it into the loop and put the time and tighten until the bleeding stops and the pulse distal to the tourniquet is cut off. So, and then for a junctional wound, if the direct pressure that I'm using with my gloved hand and gauze is not working, we're going to add a hemostatic dressing to pack the wound. And for wounds on the belly, anything above the umbilical cord or the umbilici, we're going to use an inclusive dressing. And all other wounds, we're going to apply direct pressure with sterile gauze and hold pressure. Once the bleeding is controlled, we're going to reassess the level of consciousness, the airway, breathing, circulation, and vital signs. If signs and symptoms of shock are present, we're going to place the patient supine. Place the patient supine. Lay down. And we're going to apply high flow oxygen. Before we start the oxygen, we would inflate the reservoir. We're going to cover the patient and keep them warm and preserve their body heat, and initiate rapid transport to the appropriate facility or request an ALS intercept. If the patient is not showing signs and symptoms of shock, we would still consider an ALS intercept depending on the patient's bleeding, if it's controlled, and the time it would take to intercept as opposed to just going. So that's it for bleeding and shock.